Hello doctors, welcome back to the MedicoTube, and today's detailed analysis will give you a complete and crystal clear understanding of the Round 1 All India Quota NEET PG 2025 closing cutoff for all government medical colleges, along with the expected branch benefits, career pathways, and the kind of medical life each specialty offers, so that you make the smartest and most confident decision during round 2 choice filling. And before we begin, if you are new here, make sure you subscribe to the MedicoTube because our mission is to give you the most accurate, unbiased, and deeply researched counseling guidance. Yesterday, the official allotment result for NEET PG Round 1 was declared, and based on that, the closing cutoff for the branch of MD General Medicine stands at 3,822 with marks around 593. And this branch remains one of the most powerful foundations in postgraduate training because it gives you mastery over internal organ systems, opens doors for multiple super specialties like cardiology, nephrology, gastroenterology, and neurology, and even if you stay in core general medicine, the respect, stability, and clinical command remain unmatched. Moving ahead, the branch of MD Radio Diagnosis closed at 2,920 with marks around 601, and this is currently the most premium and competitive branch in India because of extremely high lifestyle flexibility, top-tier earnings, minimal emergencies, and the ability to work in hospitals, diagnostic centers, or even start your own practice, making it a dream choice for many aspirants. And if you find this analysis helpful, consider subscribing to the MedicoTube for more high-quality counseling updates. And doctors, this is just the beginning of our NEET PG 2025 counseling series on the MedicoTube, because from here onward we will also be bringing you the complete branch-wise cutoff for DNB and NBE diploma seats, so that you clearly understand where your rank stands and what your safe options will look like in round 2. Along with that, we will soon release the expected round 2 cutoff analysis based on last year's trends, this year's round 1 movement, and the pattern of vacant seats, so you can plan your choices with full confidence and avoid unnecessary risk during upgradation. So stay tuned, keep learning, and make sure you subscribe to the MedicoTube so you never miss the crucial updates that can literally change the direction of your NEET PG journey. The next closing cutoff is for MD Obstetrics and Gynecology or MS Obstetrics and Gynecology, which closed at 9,714 with marks roughly 557, and this branch gives you a unique emotional and surgical blend. You manage women's health, deliver babies, perform major surgeries, and develop long-term patient trust, and although the workload is high, the satisfaction and opportunities are equally high. Then we have MS General Surgery closing at 11,507 with marks around 548, and surgery is the backbone of every multispecialty hospital because it teaches precision, discipline, and hands-on mastery. With this branch you can later pursue super specialties like urology, neurosurgery, cardiothoracic surgery, plastic surgery, and surgical oncology, making it a strong choice for those who love operative work. MD Dermatology closed at 2,725 with marks around 603, and dermatology is a gold standard lifestyle branch with extremely high OPD-based practice, cosmetic procedures, aesthetic dermatology, laser treatments, hair and skin procedures, and almost no emergency calls, giving you flexibility along with strong financial prospects. MS Orthopedics closed at 12,429 with marks nearly 545, and ortho is perfect for doctors who enjoy quick-impact surgeries like fracture fixation, joint replacements, and sports injury management. It is physically demanding but extremely rewarding with strong demand across cities and towns. MD Pediatrics closed at 7,071 with marks around 571. And pediatrics gives you deep expertise in child health, neonatology, and developmental care. Although emergencies are common, the emotional satisfaction and long-term family trust make it a very fulfilling career. MS Ophthalmology closed at 16,969 with marks around 526, and this specialty is one of the best in terms of balance, high surgical precision, minimal emergencies, and excellent long-term earning potential through cataract, refractive, and retina practices. MS ENT closed at 17,851 with marks around 523, and ENT gives you access to diverse surgeries like tonsillectomy, endoscopic sinus surgery, thyroid operations, and even skull base work. It is a compact but powerful branch with a great OPD surgery mix. MD Respiratory Medicine closed at 9,780 with marks around 556, and this branch gained massive importance post-COVID, with rising demand for pulmonologists, sleep specialists, and critical care physicians. It offers strong job security and broad practice opportunities. MD Emergency Medicine closed at 13,772 with marks around 539, and this is the frontline specialty that shapes your skills in trauma, acute care, stabilization, and rapid decision-making. Globally, this branch has very high value, and even in India the demand is rising fast due to emergency departments expanding in every hospital. If you like high-energy clinical settings, this is the perfect branch. MD Psychiatry closed at 16,458 with marks around 528, and mental health is one of the fastest growing fields today, with massive demand in hospitals, private practice, and digital mental health platforms. The branch gives excellent lifestyle balance and deep patient connections. MD Anesthesiology closed at 19,028 with marks around 519, and this specialty is the silent backbone of all surgeries, intensive care, and pain management. It has one of the strongest job markets in India, with opportunities in critical care, OT anesthesia, pain clinics, and emergency services. MD Radiation Oncology closed at 17,190 with marks around 526, and this branch plays a crucial role in cancer treatment involving radiotherapy planning and cancer care teamwork, and the demand is rising because cancer centers are increasing nationwide. MD Pathology closed at 36,444 with marks around 464, and although not a patient-facing branch, pathology is the diagnostic heart of medicine, giving you opportunities in labs, hospitals, research, and even running your own diagnostic center. MD Community Medicine closed at 54,470 with marks around 415, and this branch gives you strong opportunities in public health, epidemiology, government healthcare programs, and institutional teaching with a stable lifestyle. MD Pharmacology closed at 68,632 with marks around 379, and this branch allows you to bridge medicine and research, with career options in drug trials, pharma industry, teaching, and regulatory science. MD Forensic Medicine closed at 72,787 with marks around 368, and this specialty gives you expertise in medical legal work, government roles, forensic investigation, and courtroom medical responsibilities. Finally, MD Microbiology closed at 64,970 with marks around 388, a branch that offers deep involvement in infection control, lab diagnostics, academic roles, and research, especially relevant after the growing emphasis on antimicrobial resistance and hospital infection control programs. Doctors, this entire analysis is built from the official Round 1 allotment and is designed to guide you towards smarter branch selection during counseling. If you want more detailed branch-wise counseling guidance, subscribe to the MedicoTube for authentic and student-friendly insights, and keep following our channel for every update that shapes your NEET PG journey.